As you know that already we have started the pelvis anatomy, and there we have studied about the some of the landmarks over there, how the landmarks are related to the pelvis that we have discussed. And here we'll see the relation of the muscles, the organs, okay, and the ligaments, how they are related to each other, that we'll see here. So this class is your pelvis anatomy review class. So for that reason, we have to draw the diagram to make clear about the bony pelvis first, right? So as you know that here you'll find the sacral promontory, okay, and after the sacral promontory, you'll find the ala of the sacrum over here, and you can say the mass of the sacrum. And here at this point you will find there is a presence of your sacral canal, or the part of your vertebral canal. Then this mass that is going backward, and here you will find the spinous process of the sacrum, okay. So at, at this point you will find the ventral uh, surface of the sacrum, right? So this ventral surface is over here, and just below to that you'll find the coccyx over here. No, so the four bones, they just fuse it together to make the coccyx, and here you'll find the sacral foramina over here. Here is the both the side you'll find the sacral foramina. So this is ventral surface of the sacrum, which is smooth, and it is concave anteriorly. And as you know that from this region you will find the ilium uh, articulation, right? So this is your iliac crest over here. So this iliac crest that is making here the ASIS, anterior superior iliac spine, and the iliac tubercle over here, okay, and that articulates with the sacrum. So like that, in opposite side also you'll find the iliac crest over there. Then you'll find the ASIS, anterior superior iliac spine, and you'll find the iliac tubercle or tuberosity. Then it articulates with this sacrum, both the side. Okay. Then from this ASIS, you will find there is the uh, anterior border of the ilium over here. Then you'll find the anterior inferior iliac spine over here, and that continues is the margin of your acetabulum. So here you'll find the margin of the acetabulum. Then if we'll go ahead, okay, you'll find there's the ischial tuberosity over here, and that makes here the so here you'll find this is your ischial tuberosity, and here you'll find this is your inferior pubic ramus, and this is your ischiopubic ramus. So that is going towards the midline, and at this midline it articulates with another side of the hip bone in this fashion, right? So here also you'll find the inferior pubic ramus, and then here you'll find the ischial ramus. So both they combinedly known as your ischiopubic ramus. So here again it forms your ischial tuberosity, and you just draw the again the anterior border of the opposite side of the hip bone, and here you'll find the AIIS. Then that also makes the margin of your acetabulum, okay. Then that will just descend downward as the ischial tuberosity. So in this way you can draw the mm, ischial tuberosity along with the whole of the hip bone over here. And at this point you will find there is the presence of your obturator foramen, right? So as you can see here, at this point you will find there is the presence of your obturator foramen. So here also you will find the obturator foramen over here. So this obturator foramen, that indicates over here that this is the ischiopubic ramus. Okay, and from here you will see there is the presence of your arcuate line. So that arcuate line that is coming towards the ilium and the ischium, right? And it makes the iliopectineal line over here. Okay, and that makes the arcuate line. So the arcuate line, that is nothing but the, here you'll find the iliac line, and here you'll find the iliopectineal line. So they combines together to make the arcuate line. So just draw the same thing at the opposite side. Here you'll find the arcuate line and the iliopectineal line, and that makes over here your hip joint. Okay, so now at this point you'll find this is your superior pubic ramus, and here it is your, actually you can divide it into two parts. This medial part is the pubic ramus, inferior pubic ramus, and this lateral part, that is your uh, ischial ramus, right? And both combinedly known as your ischiopubic ramus, or sometimes it is pronounced as ischiopubic ramus. So it depends upon you what you will pronounce. So this is your ischiopubic ramus. Okay, and here you'll find this is your obturator foramen, and here you'll find there is the presence of the spine. Okay, so this is your ischial spine, both the side you'll find. So the important of this ischial spine, it is actually inverted in male. It is inverted in male. Okay, and it is everted in female. Okay, why this is thing? Because actually this inverted spine, the ischial spine, that makes sure about the gender of the pelvis, right? So in female it is everted, because the everted spine will give more space to this pelvic area, right? So that the fetus uh, that can stay inside this pelvic cavity easily. And also during the pacturation, what will happen during the passage of the baby's head, okay, towards downward, if it this ischial spine will be inverted, then that may injure, or that may cause some damage to the fetus. Along with that, there will be difficulty to pass the fetus to downward. That's why in female you'll find this ischial spine is everted in nature. So here you'll find this is the sacral promontory over here. So this sacral promontory, that is actually swallowed in female, and it is more convex in male. Okay, and this convexity, that actually uh, that reduces the space of the pelvic cavity. That's why you'll find in female pelvis there will be the decrease convexity, or you can say the shallowed part of the sacral promontory. Okay, and as you know that whole over this line what we have drawn here in oval shape, so this is known as your pelvic brim. So this pelvic brim that divides this whole over the pelvis into two parts. Just above to this pelvic brim, whatever is present over here, that is the false pelvis, and just below to the pelvic brim, that whatever the space is present over there, that will be known as your true pelvis. Okay, where you'll find the pelvic viscera like your urinary bladder, you'll find the uterus, you'll find the upper part of the vagina, you'll find the rectum, lower part of the rectum, and the anal canal, and prostate, right? And some glands, they are just present inside this pelvic cavity. And in true pelvis, you will find over here, this is your right side. So at the right side, you will find the ilium over here, and the appendix over here, right? And you'll find that there is the uh, mm, starting of your ascending colon over there, right? And some of the small intestines, they are also present over here, the part of your ilium, that is present here at the false pelvis, because the ilium that will go towards the cecum, and that will form your ileocecal junction, right? And that uh, the cecum will start as a large intestine afterwards, right? So cecum, it is cecum and appendix that is rest over this fossa, right? And all you know that this fossa is known as your iliac fossa, right? Then here you'll see the inferior pubic ramus and the you can say direct ischiopubic ramus. So this ischiopubic ramus, that both the outer border of the ischiopubic ramus, that makes an angle over here, and this angle, as you can see over here, right? So this angle is known as your subpubic angle. So this subpubic angle, that determines the what is the sex of the pelvis. Okay, so here if you'll see that the angle that will be 90 degree, or approximately it is 90 degree or more than that, more than the 90 degree, right? Then it is considered as a female. Okay, because uh, it needs more space, no, to pass the fetus. That's why it is wider in female and it is narrower in male. Okay, so if the uh, angle that will be less than the 90 degree, then you'll find pelvis may be the male. Okay, so 90 degree and above female, and 90 degree below is the male, right? That is one of the sex determination in the pelvis. Okay, so after all these things, see here you will find some of the diagrams we'll do from the lateral side, so that it will be more clear to mention the ligaments and the muscles over there. Okay, so as you have seen over here, that there is the presence of your ASIS over here. Just you are seeing the lateral view, then the iliac crest over there, right? And here you'll find this is ASIS and the tuberosity over there, then the iliac crest that is going in this way. And from this ASIS, you will find there is the anterior border of the ilium, then that makes the spine over here, anterior inferior iliac spine, and that anterior inferior iliac spine that continues towards the pubis. Okay, so here you can see there is the superior pubic ramus over here. Okay, and the superior pubic ramus that makes a tubercle over here. So this tubercle is known as your pubic tubercle, and then here you'll find the pubic crest over here, and this is the body of the pubis. So here you'll find the symphysis part of the pubis over here. Then at this point you'll find the ischiopubic ramus that is going to backward. Then that makes here the tuberosity, the ischial tuberosity over here, and that ischial tuberosity that ascends upward, and that makes here a notch over here. So this is your uh, inferior sciatic notch, then that ends over here is a spine. So this is your ischial spine, and this ischial spine that continues is a greater sciatic notch over here. Okay, and at this point you'll find there is a presence of your obturator foramen. Okay, and from this pubic crest, as you know that this is your ischiopubic ramus, and here is the superior pubic ramus, and from the superior pubic ramus, you'll find the arcuate line that is just going backward, right? At this point, so at this point, what you'll find there is the presence of the sacrum over here. So here you'll find the body of the sacrum. Okay, and the here you'll find the ventral surface of the sacrum that is just coming downward, and here you'll find the whole of the ventral surface, but we are seeing from the lateral side, right? So so here you'll find the ventral surface of the sacrum, right? So this is the ventral surface of the sacrum. Here this is the lateral surface of the sacrum, right? So at this point you'll find these openings. Okay, they are the sacral openings, and here you'll find these are the landmarks to identify the how the five pieces of the sacrum that fuse together to make one sacrum over here, right? So this is your ventral surface of the sacrum with sacral foramina, and we have taken the sagittal section, right? So that's why this is the body of the sacrum. Here also the body of the sacrum, and you can see the 1, 2, 3, 4, 5. So five sacral vertebrae, they just fuse together, and in between that here you'll find the fibrocartilaginous disc. Okay, and that is also mm, become fused over here, and at the posterior side here you'll find there is the presence of your sacral spine. Okay, or you can say the spinous process of the sacrum, and this spinous process of the sacrum at the level of S3 and or in sometimes S4 and S5, that is becoming unfused over here. Okay, so here you'll find the first spine, here the second spine, here is the third spine, but the fourth and fifth spine they are not fused together. So you'll find the lamina over there. Okay, and here you'll find this space. This is actually the sacral canal, no, through which the sacral nerve and your quada equina, right, and the phylum terminally, they will just come from this what is that spinal cord to downward. No, here you'll find the coccygeal nerve also that is coming towards here, right? So this canal is known as your sacral canal, is like your vertebral canal, and here you can see there is a hiatus that is forming over here, right? So or the gap that is forming over here, right? So this gap that will be known as your sacral hiatus. This is known as your sacral hiatus, right? So the sacral hiatus that actually clinically important to draw the CSF fluid, okay, from the your what is that spinal cord, right? So here you'll find that there is no such important nerves that is coming from the spinal cord. So if you'll insert a needle through the sacral hiatus, then you can access into the CSF, the cerebrospinal fluid. Okay, and it is very less dangerous site, no, to draw the CSF fluid, because there is only one nerve that is coming down as a coccygeal nerve. Okay, so that's why this is the safe site to draw the CSF. Along with that, to infiltrate the antibiotics or whatever medications, no, for the treatment of your meningitis, or you can say the encephalitis, right? So for that reason we are injecting the medications through this sacral hiatus. Clear? Then after all these things we'll see here that there is a here you'll see this is the lower part of the sacrum, okay, and just below to that here you'll find the coccyx over here. Okay, so this is the coccyx. So from this you'll find there is the presence of one of the ligament, right? So this ligament is coming down, right, towards the ischial tuberosity. So that will be from the lower border of your sacrum, and from the coccyx this ligament is coming down towards the tuberosity, right? So this is the ligament. This ligament will be known as your sacrotuberous ligament, right? So this is your sacrotuberous ligament. So this sacrotuberous ligament, that here you can observe that it is just dividing this greater sciatic notch and the lesser sciatic notch. It is just converting this notch into foramen, right? So here you will find the greater sciatic foramen, and here you'll find the lesser sciatic foramen, right? So this sacrotuberous ligament, it plays a key role, no, to divide this to what is that, to convert this notch into the foramen, right? So after this you'll find there is another ligament. Okay, so that ligament, it is just coming from the lower part of the sacrum again. Okay, and it is also coming from the coccyx over there. Okay, and it is coming towards the spine. Okay, ischial spine, right? So here you'll find another ligament, right? So this ligament, that is known as your sacrospinous ligament, because it is coming from the sacrum. Okay, and it is going towards the spine, ischial spine, right? So this is known as your sacrospinous ligament. Okay, so the sacrospinous ligament, that plays a very important role to stabilize the pelvis over here, because whenever the compression force or the shearing force will be there to the sacrum at the L5 and S1, that you know that this is the area where the maximum load that is distributing, right, through the SI joint to downward. So when the shearing force will come, then there is the chance of the shifting of this sacrum towards the anterior side, so that here you'll see that the lower part of the sacrum, that may go backward, right? So to prevent that, there is the importance of this sacrospinous ligament, right? So this sacrospinous ligament, that actually holds this sacrum in its proper position. So here we'll see this is your body, and the symphysis part of the pubis over here, right? And here you'll find this is your obturator foramen. So from the margin of this obturator foramen, here you know that there is the fascia. So in osteopathy, it is the fascia, they are very important in osteopathy, right? That's why you have to know what is this fascia and how they are distributing. And as you know that just above to this iliac spine, you'll find there is the presence of the thoracolumbar fascia, right? So when this thoracolumbar fascia, that is a continuous sheet, when it is coming downward and it is crossing to this iliac crest, its name changes to what is that, pelvic fascia. Okay, that is known as your pelvic fascia. And in also you can know that is the endopelvic fascia, right? So this the thoracolumbar fascia, when it crosses to this iliac crest, it becomes your endopelvic fascia. But remember here, the endopelvic fascia, when it is coming towards the uh, pelvis, as you know that here you'll find this is your iliac fossa, right? So at this iliac fossa, you'll find there is the one muscle that takes origin and that is going downward towards the femur, no, towards the lesser trochanter of the femur. So that muscle is known as your iliacus muscle, right? So when this endopelvic fascia that is covering to the iliacus muscle, its name changes to the fascia iliaca. That will be known as your fascia iliaca. Okay, and when it will cover to the psoas major muscle. Okay, it will be known as your psoas fascia. Okay, when it will cover to the rectum. Okay, and to the urinary bladder, there you'll see it is the rectovesical fascia. Okay, like that, when it descends downward, okay, at the obturator foramen, it becomes the obturator fascia, right? So this obturator fascia that actually covers this obturator foramen, okay, like a membrane sheet over here. So this membrane sheet is known as your obturator membrane, and this obturator membrane is nothing but the fascia. Okay, which fascia that is? Obturator fascia. Obturator fascia. Okay, and this obturator fascia, it is nothing but the derivation of your thoracolumbar fascia, and this thoracolumbar fascia that makes here the endopelvic fascia, and this endopelvic fascia again it is renamed according to its position, right? At the iliacus muscle, fascia iliaca; at the psoas muscle, psoas fascia, right? Like that, here you'll find the obturator fascia. Okay, so this obturator fascia thickening that makes the obturator membrane over here, right? And from this, here you'll find that this obturator membrane it has a deficiency over here, right? At this point, you'll not find the obturator membrane, and this that makes this what is that the deficiency that makes a canal over here. Okay, and that canal will be known as your obturator canal. Obturator canal. Okay, this one. So this obturator canal through which your obturator nerve, okay, and your obturator artery that passes from this pelvic cavity towards the lower limb, right? So this is your obturator canal, that is a deficiency inside this obturator foramen, okay, which is covered by the obturator fascia. Clear? Then from this obturator fascia, and from the outer margin of the obturator membrane, okay, and from the obturator fascia, here you'll find a muscle, right? So this is the inner side, right? We are looking the hip bone. So this is the actually part of the pelvis, the sagittal section of the pelvis, right? So here you'll see there is one muscle that arises from this obturator membrane and from the edges of this obturator foramen, and that muscle it is going towards the your what is this one, your lesser sciatic notch, right? So this is the fibers of the muscle, and this muscle it is going towards the lesser sciatic foramen, and here the tendinous part of this muscle that is going towards the lower limb by bending sharp 90-degree over here. Okay, so here you can see this is the tendon of the this muscle. What is this muscle? This muscle is known as your obturator internus muscle. Okay, this is your obturator, and it is arising from the inner surface. That was it. That's why it is known as your internus. Okay, this is your obturator internus muscle. So this obturator internus muscle, it arises from the edges of the obturator foramen along with the obturator membrane, and it goes backward towards the lesser sciatic foramen. And at this lesser sciatic foramen, it makes a 90-degree sharp bending. Okay, the tendon and going towards the your trochanteric fossa of the femur. So, like that, here you'll find another muscle. As you know that here you'll find there is the a origin point here and a origin point over here and an origin point over here at the ventral surface of the sacrum between the S1 and S2, S2 and S3, S3 and S4, E-shaped origin you'll find, right? So this is your piriformis muscle. So this piriformis muscle that takes origin from the sacrum, and it also takes origin some part of the sacrotuberous ligament, and that muscle that is going from this inner side of the pelvis towards the greater sciatic foramen. Okay, then it goes outside the foramen. Okay, so this is your piriformis muscle. So this piriformis muscle, it arises at the inner part of the pelvis, but through the greater sciatic foramen it goes outside the pelvis, and that attaches to again to the greater trochanter of the femur, right? So this is the key muscle over here. Here you will see there is the greater sciatic this foramen that again divided into two parts, the upper part of the greater sciatic foramen and the lower part of the greater sciatic foramen, right? And here you know that this upper part through which your superior gluteal nerve and your superior gluteal artery that will pass, but inferior to this piriformis, whatever the foramen that forms over here, that is the part of greater sciatic foramen only, but through which you will find the inferior gluteal nerve and the arteries and vessels, they will pass through this inferior part. Okay, and from the superior part, you know that sometimes the part of the sciatic nerve that also passes through this one, right? So as you know that here it makes the sacral plexus over here, right? So these are the nerve rootlets, they makes the uh, sacral plexus, and from this sacral plexus one of the nerve, no, that just united together here like this. Okay, and they will go to outside, okay, through the lower border of this piriformis muscle to the inferior part of the greater sciatic foramen. They will go outside as a sciatic nerve, right? So this is your sciatic nerve. So sometimes what we find, the sciatic nerve in 80% cases, the sciatic nerve that is passing through this inferior part of the greater sciatic foramen. But in some cases you will find this. This is actually the sciatic nerve has two components, right? You'll see that it has two components. One is your tibial component, and one is your peroneal component. Okay, so the tibial part of the sciatic nerve and the peroneal part of the sciatic nerve, they just united together by a fascia over here. Okay, so that fascia that unites these two nerves, okay, together, and that combination of these two nerves, that will be Okay, so this is common peroneal, right? Common peroneal nerve. So these two nerves combinedly known as your sciatic nerve. Okay, and that fascia that will be absent when the sciatic nerve it will go down towards the back of the thigh, right, at the hamstring region. Then just above to the popliteal fossa, this fascia will be absent, right. At that time, the tibial component that will go straight to downward, and the common peroneal component that will go laterally towards the fibula, right. But in some cases, what we'll find this fascia it is absent at this uh, inside this pelvis only. Okay, at that time, what will happen? Some part of the uh, uh, this nerve, okay, is known as your tibial nerve that may pass above to this sciatic what is that, this piriformis muscle, and some components that makes the common peroneal nerve that will pass below to this piriformis, right. So commonly the sciatic nerve passes at the inferior border of the piriformis muscle to downward. In some cases, due to absence of the fascia surrounding to the sciatic nerve, okay, that will divide this sciatic nerve into two components. One component, the tibial component, that will pass superior to this piriformis muscle, whereas the one component that is the common peroneal part that may pass just at the inferior border of the piriformis muscle, right. So at that time, what will happen? If any spasm will be there to this piriformis, or any pathological condition will be there to this piriformis muscle, then that may give a compression effect to this tibial nerve. So the tibial nerve course that will be painful and dysfunction, right. And in some cases, in 10% cases also, you'll find that the sciatic nerve that is just piercing to this piriformis muscle and going to outside, right. Whether it is going either inferiorly or superiorly, it will just pierce this piriformis muscle, and that will go towards the outside, then towards the lower limb. At that time, a small axon of this piriformis that may also compress this nerve, no, to the sciatic nerve, no. At that time, pain, numbness, paresthesia, okay, that will be you will find the radiating pain of the patient, and complain of the pain during the action, like your lateral rotation or medial rotation of the thigh. You'll find that pain aggravates over there. Okay, so like that, you'll find some other muscles, right. So these muscles, that is actually, just I'll show you over here. So after this piriformis muscle and this obturator internus muscle, okay, what you'll find, this obturator internus muscle that is again covered by the fascia, right. So that fascia, as I told you, what is that fascia? That is the obturator fascia, right. So at the obturator fascia, there will be a thickening of the obturator fascia will be there. So just I will draw in another color. Okay. So here you'll find the thickening of the obturator fascia. Okay. And from this thickening of the obturator fascia, and from the what is that, your body of the pubis, right. Here you'll find there is a muscle. Okay. That muscle arises at this region from the pubic part, from the iliac part, okay, and from the thickening of this obturator fascia, okay, and that is going in this way. So this muscle is known as your levator ani muscle. Okay, so this is your levator ani muscle, right. So this levator ani muscle, that is actually a uh, muscle that is going towards backward, okay, and towards the medial side, okay, backward and medially, right. Here we'll see this is the lateral margin of the uh, levator ani muscle, and this is your medial margin of the levator ani muscle, right? So here is one side of the levator ani, right? So this medial portion or medial margin of the levator ani, that is going towards the backward and towards the medially, right? So both the side of the levator ani, they will just make a diaphragm over here, no? And that diaphragm made by this levator ani will be known as your pelvic diaphragm. Okay, that will be known as your pelvic diaphragm, and that is made up of your levator ani muscle. Okay, so both the side, no, here just we have seen only the one side of the levator ani. Okay, so this is only one side of the levator ani, and in another sagittal part of the hip bone, you'll find like this another levator ani, right? So both the levator ani, they makes the pelvic diaphragm. Okay, so to understand this muscle, okay, just we have to draw another diagram to show you the relationship of this levator ani. Okay, so here you'll see that there is, just I'll draw. Here you are looking from below towards the top. So at this point you'll find the symphysis pubis over here. Okay, and here you'll find the the pubic crest and isthiopubic ramus. Okay, and here you'll find this is the pubic part. No, so you are just looking from towards the top, right? So at this point what you'll find, there is the presence of your sacrum, no, and the coccyx over here. Okay, so these are the sacral hiatus over here, right? Y- you are looking from, you are standing at the ground and you are looking to top, right? So it is the inferior view of the pelvis, right? So here you'll find this pelvic brim over here. Okay, and this is the sacrum, and here we'll find the uh, pubic symphysis over here, right? So at this point you'll find some of the muscles, right? What is that muscles? The levator ani. Okay, so before going to this levator ani, as you know that at this point you'll find there is the presence of your perineal body over here at the center. Okay, you'll find the perineal body. Okay, and okay, just I'll erase this one. So the perineal body will be at the center at this point, right? So this perineal body, that is the fibro muscular. Okay, a mass of tissue that is present at the center of the perineum, or you can say at the center of the lower part of the pelvis, which gives attachment to many more muscles and the fascia, and that gives the strengthening effect to the pelvic diaphragm, right? So just anterior to this, what is that? The perineal body. Here you'll find the urogenital hiatus. Okay, here you'll find the urogenital hiatus, and posterior to this perineal body, there you'll find there is the presence of your anal canal. Right. Here you'll find the anal canal. Right. And here you'll find the anoperineal membrane. Okay. The, here is the perineal body, and this is the anoperineal membrane, right? So now we'll place the muscles, okay, here, so that it will be clear how these muscles are arranged over here. Okay, so now from this pubis, okay, one muscle that is coming towards the perineal body in this way. Okay, so here is a muscle, right? So this muscle is known as your, this muscle that will be known as your levator prostatae. Levator prostatae in male, okay, and sphincter vaginae in female. Okay, so the name of this muscle is levator prostatae in male or sphincter vaginae in female. Okay, then just behind to that, here you'll find another muscle. Okay, that muscle, it is just coming from the pubic part of the ilium. Okay, and that muscle, it is going backward, okay, and towards the medial side, and it is just making a sling around the rectum over here. Okay, and here you'll find the sling of the rectum. Then again here also you'll find this muscle, right? So this muscle arising from the pubis, or we can say the pubic bone, and that muscle, it is just surrounding, make a sling over the rectum, then going to the opposite side, right? So this muscle will be known as your puborectalis muscle. Puborectalis muscle. Then here, so this puborectalis muscle, actually it helps as a as a sphincter of the rectum, right? So whenever the position changes, okay, then this rectum, that is compressed by this puborectalis tendon. Okay, so that helps as a external sphincter of the rectum. Okay, what is that? Puborectalis muscle. Okay, like that, here you'll find another muscle. Okay, so that muscle, that is coming from this ilium, okay, towards the coccyx over here, right? So here we'll find another muscle. So this muscle is your iliococcygeus muscle, right? This muscle will be your iliococcygeus muscle, right? So this muscle, it is just attaching to the coccyx over here. Okay, so iliococcygeus. Okay, and whatever the remaining part of the uh, you, whatever the remaining portion you left over here, okay, that is actually filled by the coccygeus muscle, right? This is your coccygeus muscle. Okay, so what are the things? Here you'll find the levator prostatae or the sphincter vaginae at the anterior part. Okay, and here you may get the urethra over here. Okay, in male, and you'll find the opening of the vagina in female, right? Because this is your urogenital diaphragm. So this muscle is your levator prostatae muscle. Just back to that, you'll find the puborectalis muscle, and just back to that, you'll find the iliococcygeus muscle, and this is your coccygeus muscle, right? So here, all these four muscles, they combinedly makes a diaphragm over here. So this diaphragm will be known as your pelvic diaphragm.